Welcome. My name is Dr. Underwood, and I wanted to take a brief moment to introduce myself. So when you come in, you have some level of familiarity with me. I've been in medicine for almost 30 years. Starting in the mid-90s in the United States Air Force as a medic, I was fortunate enough to be exposed to many different types of medicine, whether you're talking general med surg, pediatrics, and then subsequently specializing in critical care, where I had an opportunity to be a team member of the critical care ground transport team, and then the once in a lifetime opportunity of actually getting to fly on the critical care air transport team. I've now been in private practice for 16 years and taken a lot of those experiences from the military and critical care and rolled them into my private practice. So my patients often say I'm able to offer a definitive level of care because of my understanding of the human body to identify conditions outside of what chiropractic would treat, such as high blood pressure, whatever else. Subsequently, over the last 10 to 12 years, I've specialized in sports medicine and chronic unresolved pain. People say, Doc, what is chronic unresolved pain? And typically, I like to associate that with pain that you've had for more than 6 months to a year. We're talking about long-standing pain that has not resolved with physical therapy, other chiropractors, pain management, surgery. Chronic pain respond well to one type of therapy, and that's soft tissue therapy. And soft tissue therapy is simply treating the muscles, ligaments, tendons, and even nerves of the body. And I'm able to do that very effectively with using active release technique. The other main facet of my practice, I always say it's about 50-50. I've got 50% chronic unresolved pain, which we just talked about. And if you have any more questions about that, you can always give me a call and see if I can help you out or find somebody to help you out. But the other main heading is sports medicine. I'm on staff with 2 universities, UMSL University over in St. Louis and McKendree University, and have been for years. Prior to that, I was with Lindenwood University in Belleville, and I consult with St. Louis University as well as Washington University. Sports medicine for me is utilizing active release, but I've also taken additional coursework and become a certified chiropractic sports physician, which I've spent another, I believe it was 120 hours learning more specific about sports injuries, and just recently completed my master's in sports science and rehabilitation. Coupled that with me still currently being an EMTB for the city of O'Fallon and have been for 23 years, I understand sporting injuries as well as acute injuries that a lot of athletes face. As I've said before in other videos, there's not a professional sporting team, regardless of what that team is, that doesn't have somebody on staff that utilizes active release to fix those sporting injuries. It almost always goes back to a soft tissue injury or a muscle usage injury, and that's what we focus in on here when I say we do sports medicine. One of the things I like to take a moment to discuss is finding the right chiropractor, because a lot of patients say, I've tried chiropractic and it didn't work. We all have the same base education, much like MDs do. They all go through medical school, we all go through chiropractic school, but then we can specialize into different realms or different fields. For me, as I mentioned, that's sports medicine and chronic unresolved pain. Other chiropractors do newborns or wellness or pregnant moms or headaches. So when you have a condition, you make sure you have to find the right chiropractor. Here we're a very time-focused, appointment-based. New patient exams are about an hour. We methodically go through your history and discuss what your condition is, how long you've had it. You have to realize in the body there's about 206 bones, but there's over 3,000 soft tissue structures. That's the component that gets missed. That's what we focus on here at Underwood Chiropractic. That's what makes us different.